We had never thought we'd see anything of this sort in 2020. Things haven't been the same since. We can't even imagine the last time it was okay to go watch sports in crowd, drink a pint of beer in the pub, or even go out on a romantic date with your chosen one. But now, thanks to the coronavirus, we can't even go out without putting on a mask and our hands smelling like a cheap tequila shots. Anyway, here are 10 COVID-19 facts you may need to know. 1. Anosmia, loss of smell, is a symptom. The most commonly reported symptoms of COVID-19 include fever, cough, and shortness of breath. However, as the disease has spread around the world, healthcare providers have noticed a few unusual symptoms, including loss of smell, anosmia, and decreased sense of taste, ageusia. Doctors recommend that anyone who experiences a sudden loss of smell or taste self-isolate and contact their healthcare provider. 2. SARS-CoV-2 binds tightly to human cells. Researchers have recently discovered an important difference that may explain why the new coronavirus is so hard to stop. SARS-CoV-2, the virus that causes COVID-19, binds 10 to 20 times more tightly to human cells than SARS-CoV, the virus responsible for SARS. 3. Coronavirus can make babies seriously ill. Compared to adults, children appear much less likely to get sick if they contract the novel coronavirus. However, the very young, less than 1 year, appear to be more vulnerable to serious illness than older children. 4. The COVID-19 virus can live on surfaces for days. Researchers have found that the virus can live up to 24 hours on cardboard and 2 to 3 days on plastic and stainless steel. The CDC reports that the virus was detected on surfaces of the Diamond Princess cruise ship up to 17 days after passengers disembarked. However, only pieces of the virus were detectable, not viruses capable of infecting a person. 5. People who don't have symptoms can spread the virus. Wearing a cloth facial covering when you go to a public indoor place protects others because you could be infected and not know it. Wearing a mask reduces the risk of unknowingly spreading the virus to others in the space around you. 6. You may already have been infected. Some people never develop symptoms. And some people who had what they thought was a bad cold or the flu may have actually had COVID-19. Scientists developed tests that can detect SARS-CoV-2 antibodies in the blood, which is evidence of past infection with the virus. Such tests may help us eventually understand the true extent of this pandemic. 7. Some people with COVID-19 have digestive symptoms. Cough, fever, and shortness of breath are the most common symptoms of novel coronavirus infection, but many people also experience digestive symptoms, including lack of appetite, diarrhea, vomiting, and abdominal pain. According to a study published in the American Journal of Gastroenterology, 48.5% of 204 people admitted to the hospital with COVID-19 had digestive symptoms. 8. Reinfection may be possible. If a person gets COVID-19, are they immune to future infection from SARS-CoV-2? And how long will immunity last? 10 to 30% of our common colds are caused by 4 different coronaviruses, and we all know that having a cold doesn't keep you from catching another cold. But animal research suggests the novel coronavirus may be different. Macaque monkeys who were exposed to SARS-CoV-2 after recovering from COVID-19 did not develop another infection. 10. Woman spread the virus to 1,000 people. In South Korea, the virus was controlled until the number of cases reached 30. But the woman, codenamed Patient 31, immediately infected about 1,200 people. Over 10 days, the number of infected in South Korea increased from 30 to 5,000. Now that the vaccine is out, did you get your share of shots yet? Also, what is the one thing that you miss the most from the good old before Corona days? Write down in the comment section below. Like if you liked it, subscribe if you loved it, and also ring the bell icon to not miss anything from our YouTube channel. Peace.